Hi, this is Ajay Anand and welcome to science classes from excelup.com. In this lesson, you will learn about health and disease. And this lesson has been taken from class 9th science. There is a chapter called Why Do We Fall Ill in class 9 science. So, this lesson is based on that chapter. So, let us begin with the definition of health. What is health? Health is a state of being well enough to properly function physically, mentally, and socially. So, what does it mean? The key words are physically, mentally, and socially. So, this says that only if somebody is physically fit, but he is not mentally or socially fit, then he cannot be termed a healthy person. Similarly, if somebody is mentally and physically fit, but he is not fit socially, then he is an unhealthy person. Moreover, the concept of health, it also depends on the age group and profession of a person. So, for example, if let us take the example of an elderly person. If a person in his 70s or 80s, he is able to walk properly without help and he is able to take food on time, then he is supposed to be healthy. But on the other hand, if there is a child and he is just able to walk, but he is unable to run around or play around, then the child will not be termed as healthy. So, there is the difference because of the difference in their ages. Now, suppose there is an office worker. So, if he is able to sit all the day on the chair and able to work continually for 8 hours, then he is healthy. But if there is a dancer or there is a sportsman, so for them health means being able to do all the strenuous physical activities which are required for their profession. Okay. So, there are so many parameters while we decide whether someone is healthy or not. Apart from the personal issues, community issues also affect our health. So, the community issues are public cleanliness, economic condition, and social equity and harmony. So, if you are healthy or you want to be healthy, but you are living in a filthy neighborhood, the neighborhood has overflowing drains, narrow alleys, then heaps of garbage all around, then this is not possible to be healthy in while living in such kind of neighborhood. So, for being healthy, you also need to have a clean neighborhood. Okay. Then suppose you are living in a city which is suffering from perennial problem of air pollution, like many metro cities do. So, if there is high level of pollution in air, then you are not going to be healthy, because ultimately one day you will start suffering from respiratory tract infections. So, the cleanliness in surrounding is necessary for being healthy. Economic condition is also important, because until and unless the economic condition of the country or the state where you live is good, you won't be able to get a good job with a decent earning. And a job with decent earning is required to have proper food, proper nutrition. Without that, it's impossible to be healthy. Even the loss of earning, it also has its effect on the mental health as well. Social equity and harmony is also necessary, because if you are living in a quarrelsome neighborhood, it will tell on your mentality. It will result in mental stress and ultimately affect your health. Now, let us come to disease. Disease is a condition in which affected person is unable to carry out normal activities. In fact, the disease word itself means lack of age or absence of age. So, because of absence of age, if you are unable to carry out your normal activities, say for example, your normal activities include going to school regularly, attending your classes on a regular basis, then after coming from school, you may go for outdoor playing for a couple of hours, and after that you will try to finish your homework. But if because of certain problem, health issues, you are unable to attend your classes on a regular basis, or you are unable to go out to play, or unable to finish your homework, then you are not healthy. But how do we know that someone is sick? So, there are some symptoms which tell that the person is sick. Symptoms, they are the apparent signs, which means apparent means the visible signs. They are called symptoms. So, for example, somebody may be suffering from headache, and headache can have many underlying causes. There can be fever. Fever can be due to infection or due to exhaustion or maybe any other cause. Person can start suffering from diarrhea. So, these symptoms, they show, they tell the body, they give the signal that the person is sick. Now, what are the types of disease? The disease, it can be classified on two criteria. One is the duration and another is the cause of the disease. So, based on duration, diseases can be classified into two categories. One is called acute disease and another is called chronic disease. A disease which lasts for a short duration is called an acute disease, and if a disease lasts for a longer duration, then it is called a chronic disease. So, how long is too long? If the disease persists for say for a couple of days, maybe up to a week, at the most say 10-15 days, then this is called an acute disease. If it lasts longer than this, then the disease is a chronic disease. So, chronic diseases may last for a month, some of them may last for 6 months, and some of them they last for a lifetime. So, for example, diabetes or hypertension or arthritis, they last for a lifetime. Tuberculosis, usually it takes 6 months to treat a patient of tuberculosis. So, this is not for the lifetime. Acute diseases, they usually last for 3 or 4 days, at the most for a week. For example, common cold, flu, diarrhea, cholera. And because they last for a shorter duration, they do not cause debility. So, no organ is damaged and person is fit to resume normal lifestyle. But chronic diseases, they cause debility. For example, say if a person is suffering from arthritis, then he may not be able to walk properly, or he may not be able to handle tools, or may not be able to write. So, this has long term implication on the normal life of the person. Okay. Now, based on the causative factors, diseases can be of two types: infectious and non-infectious. Diseases which happen because of some external causes, especially because of entry of microorganisms in the body, they are called infectious diseases. Sometimes some macroorganisms, they are also involved. So, microorganisms, they are bacteria, protozoa, fungi, viruses, and worms like tapeworm and roundworms, they are examples of macroorganisms, and these organisms, they cause diseases. Some examples of infectious diseases are TB, that is tuberculosis, polio, cholera and hepatitis. Okay. Infectious diseases, they are also communicable diseases because they can spread from one person to another. Okay. So, if someone is suffering from cholera, then he can spread the disease to other persons also. Non-infectious diseases or non-communicable diseases, because they do not spread from one person to another, they happen because of some internal causes. So, there can be some problem in some internal organ, or there can be some genetic issues or lifestyle issues because of which these diseases happen. And examples of non-infectious diseases are diabetes, hypertension, arthritis and hemophilia. So, diabetes and hypertension, they generally happen because of lifestyle problem. Arthritis, it happens because of internal causes. This is called an autoimmune disorder. Hemophilia, it has genetic causes. Now, how the infectious diseases are treated? They are treated by some medicines, and the medicines, they are called antibiotic, antiviral, antifungal, anti-helminthic, based on the fact that against which of the microbes a particular medicine is acting. So, an antibiotic, it acts against the bacteria, but the antibiotic cannot work against virus or fungi or protozoa, because antibiotic, it disturbs one of the life processes of bacteria, and that is how an antibiotic stops the replication of bacteria or kills the bacteria. But the same substance does not affect the biological process or life process of virus or fungi or helminthes. So, that is why an antibiotic is not going to work against virus or fungi or protozoa or any other pathogen. Similarly, antiviral, it will work against viruses only, it will not work against bacteria or fungi. Antifungal works against fungi only, but it does not works against bacteria or viruses. So, based on this, doctors, they decide whether the patient should be given antibiotic or antiviral or antifungal or whatever. Spreading infection. Now, let us see how does infectious disease spread from one person to another person. So, there are different modes, like by air, by water, by sharing cloths, through blood or body fluids, through vectors. So, certain diseases like flu, cold, COVID-19, tuberculosis, they spread by air. So, if a patient sneezes or coughs, then he expels some fine droplets in the air, and these droplets, they contain the pathogens like viruses or bacteria. So, when some healthy person breathes in the same air, the pathogens, they enter the body of the healthy person, and that is how the infection spreads from one person to another person. Okay. And that is why you are advised to keep away from person of flu, cold or COVID-19. You are advised to wear a mask or advised to avoid crowded places, so that you can minimize the chances of getting airborne diseases. In case of spread through contaminated water or food, if somebody consumes contaminated water or contaminated food, then he will suffer with particular diseases. These diseases are cholera, polio, amoebiasis or amoebic dysentery. Some skin infections like ringworm, they spread by sharing cloths. Then there are some diseases which spread through infected syringes or needles or blood or through exchange of body fluids, and these are hepatitis and AIDS. So, exchange of body fluids, it is facilitated by sexual contact between two individuals. Okay. This also spreads from an infected mother to an unborn child, and from an infected mother to a child who is still dependent on the milk from the mother. Okay. if somebody gets infected blood through transfusion, then he may also start suffering from hepatitis or AIDS. So, these are the diseases which spread through blood or body fluids. Now, there are some pathogens or pathogens of some diseases which are spread by some animals, some agents. So, these agents, they pick the pathogen from a sick person and transfer them to a healthy person. Okay. And that is why these agents or animals, they are called vectors or carriers. So, pathogens of malaria, dengue and filaria, they are spread by mosquitoes. So, mosquitoes they are carriers of malaria, dengue and filaria pathogens. Now, what about affected organs? So, it depends. It depends especially on the mode of infection. So, for example, if the disease is spread through air, so obviously the pathogens, they first of all will reach the respiratory tract infection. So, these pathogens, they generally affect the upper respiratory tract infection, upper respiratory tract and lower respiratory tract, like COVID-19, flu, cold, tuberculosis. If the disease spreads through contaminated food and water, then this is going to affect the digestive system. Okay. But there are differences also. Say, for example, hepatitis, it goes through blood, the hepatitis virus, or through body exchange of body fluids. But ultimately, the HIV virus, it affects the immune system of the body. So, in the long run, it affects the whole body. Hepatitis, it comes through blood, some types of hepatitis, and some types of hepatitis, they come through contaminated food and water, but they affect the liver. So, some diseases, they may affect the brain also, and kidney and heart and so many organs. Okay. Now, what happens once a person falls sick? The doctor, he gives the treatment. So, the treatment includes certain medicines like antibiotics and antivirals to kill the pathogens, and then some medicines, they are given to provide symptomatic relief, like relief from fever or pain. But treatment has its side effects also, or negative aspects, we can say. So, the one aspect is the cost of therapy or cost of medicine and other things like tests and all the things, cost of stay at hospital. Then it also involves loss of income. So, if somebody is a daily wage earner, then he will lose all the wages he could have earned while he would have been healthy. Even for a salaried person, he can go on sick leave for a limited duration. After that, he will have to go for leave without pay, that is leave without salary. Then some diseases, they may also result in debility. So, it is always advisable to prevent a disease rather than go for the treatment. So, there is an old saying that says that prevention is better than cure. So, how do we prevent diseases? So, first step is to prevent exposure. So, we can prevent exposure by various means. For example, nowadays you must be seeing the ads that you should wash your hands many times in a day. Washing your hands or maintaining cleanliness, it helps in preventing various pathogens from entering your body. Then you should wear masks to avoid getting COVID-19. So, that is another way to prevent exposure. We should use mosquito repellent creams or sprays. Then we should use mosquito nets so that we can prevent bites from mosquito, and then we can prevent dengue and malaria. Then nutrition is also important, because a balanced nutrition, a balanced diet helps in building immunity. And if a person is having a strong immunity, then he can be saved from many diseases. So, you may have seen even during epidemic, many persons, they do not fall sick, and there are some others who easily fall sick, and this happens because of the difference in the levels of their immunity. Then there is a third method, that is called vaccination. Vaccine is a type of medicine which is given to a healthy person. Once vaccine goes inside the body remembers how to fight a particular disease, and this happens because a vaccine contains a weak strain of the pathogen of a particular disease. So, if somebody is given the vaccine of, say, COVID-19, then he gets some weak strain or RNA or DNA of the particular pathogen, so that body can prepare antibodies against that pathogen. So, once the antibodies, they are made inside the body will be ready for any future onslaught of that disease. So, that is how we prevent various diseases with the help of vaccination. So, vaccines are available against polio, tetanus, then diphtheria, tuberculosis, and there are so many diseases against which vaccines are available. That's all for this lesson. Thank you.